Okay, hello everybody. Welcome to another Medical Projects webinar. Couple of minutes past, so we will get started. If you've not been to one of our webinars before, my name is Mark Williams. I work here at Medical Projects. We help students on their journey to medical school and on to becoming the next generation of doctors. We've been running these webinars just over a year now. So we started doing these webinars first lockdown. And they've been really popular, so we've just carried them on. So thank you for joining us. We'll be joined by Dr. Darling in a little bit, who's going to be talking about how to reflect on your work experience. It's a really important part of the medical school application process. So we just wanted to kind of break down how to do it with some kind of real life examples that you can actually take away and kind of apply to some of the work experience you're hopefully going to gain this summer. I'll just go through a couple of the kind of housekeeping things as well. We will be sending out copies of the slides in the next kind of 24 hours, probably tomorrow. And we'll send out a recording of this as well. And we'll also upload it to our YouTube channel. So if there's anything you miss, or if you have to leave early, don't worry, it's all there. It'll all be sent to you tomorrow. We'll be using the Q&A function as well. So a key part of our webinars is making it as interactive as possible and giving you the chance to ask questions. So we'll use the Q&A function slightly later on. We'll kind of save all the questions towards the end because it's a bit easier for us to manage. And we use the upvote system when we're using the Q&A. So if somebody's already asked a question that you would like answering as well, you can hit the thumbs up button and it raises the most popular questions to the top. So we know which questions to try and answer, because we will have hundreds of questions and we can only get through so many in the next kind of 55 minutes or so. Cool. We will have some poll questions as well, and that's just to help us kind of judge who we're talking to this evening as well. So we'll crack on and we'll do those first. This is the first bit of kind of interaction for the evening. So this should just pop up on your screen. And this is just to let us know how many webinars you've attended before. If it's your first, welcome. If you joined before, that's great. And it's great to see that you're coming back and we're kind of staying with you throughout your journey. It's all anonymous as well. So we can't see kind of who's voting. So let's just end that one and we'll share the results as well so everyone else can see. So 30%, this is your first time with us. So welcome, excellent. And other 70% have come back. So hopefully we did something right in the last few webinars for you to come back. Cool. And one more question is just to kind of roughly work out what stage you're at as well. Again, helps us just understand who's watching. I'd suspect that most people for a reflection type webinar will be year 12s. It looks like that on the voting thing as well. Just give that another couple of seconds. And again, I'll share those results for you. So yeah, 80%, 81% are in year 12. Perfect time to do this if you're already thinking about work experience for summer. Getting a bit of a head start on the reflection part is really important. So that's great. Year 11s, year 10s, you're way ahead of the game. So again, awesome to see you guys here. Right, let's get on with it. So at this point, I'd probably like to bring in Dr. Darling.
Hello.
Hello. Hi, how are you?
Good, thank you. Good, thanks. Thanks for having me.
Not a problem. It's great to have you here. I know you've done some teaching on some of our kind of virtual courses as well in the last couple of months, and this is the first webinar you've done. So It's great to have you with us. So you're going to be talking about reflection. It's something it's really important at this stage of when they're applying to medical school, but it carries on all the way through, doesn't it? So it's just a topic that never leaves you as a medical student / doctor.
Yep. And I think I've got some good examples of that. And it's probably something a lot of people haven't even heard of, never mind done now, but you can't really shake it after you get in. So it's important.
Cool. So I'll hand over to you. Well, you've got some kind of slides to talk through. Do you want to share your screen, or do you just want to tell me when to click through?
I think if we just get you clicking through, that's okay. Yeah.
Yeah. Okay, cool. And then we'll have some time for questions at the end. All right.
Perfect.
There we go.
Great. So just a little bit about me, first of all. So I grew up in Belfast, Northern Ireland, hence the funny accent for a lot of you there. I studied medicine in University of Dundee, went straight in from school to that. Then I did my junior doctor foundation years and my GP training in Northern Ireland. And now I work as a GP locum, which is doing sessions for different GP surgeries around the place as needed, with an interest in minor surgery and joint injections in GP. And then I also do a bit of teaching like this and some private online work as well. You're gonna pop on the next one there, Mark. Great. So I stuck this up. A lot of you might sort of be a bit aware of this, maybe not thinking quite so far ahead as past medical school, but with talking reflection today, I just kind of wanted to throw this up to show that there's a lot of points in your medical training. And all of these points here involve reflection. Medical school, there'll be reflection the whole way through. Foundation years, to fully achieve them, there's a lot of reflection that's assessed to complete that. After your foundation years in training, GP training at the top there, it's probably the most reflective heavy in the type of assessment and the way you work through things. Other specialty training, surgery, medical things like cardiology, respiratory, again, lots of reflection. Even then in the non-training posts, if you're just locuming and working in a certain area, it's good to keep reflective entries up to date to show that you're continuing your professional development and keeping on learning. So all the way through, and then even right at the end, once you become a GP or a consultant, you have revalidation and every year that you, revalidation every 5 years and appraisal every year, which you have to have some reflecting on what you've been learning and how you've been professionally developing. So it never ends, and it's a bit of a difficult skill to master, but it's not something you're going to be experts at straight away. But hopefully with this presentation, we'll give you some advice on how to actually reflect in a good structured way and how you can use this straight away for your work experience and sort of applying for medical school. You're going to pop on the next one there. So find this quote, which is quite a succinct description of it. So what is reflection? It's the way that we learn from an experience in order to understand and develop practice. So with that, the main thing here is learning from an experience. That can be an experience done well, an experience done badly, but you're trying to understand and develop yourself further from that experience and what you can learn out of it. You want to pop on the next one there, Mark? So again, a bit more detail about it. It's an exploration and explanation of events. You're not just wanting to describe the events and fly through, I did this and I did this. You want to say what you did and why that was important and what you learned from it, and really digging into it. Reflection involves revealing anxieties, errors, weakness, as well as the strengths and successes. And with that, there's a lot of how you felt personally in the event and reflecting on the personal experience that you had and the feelings and the way that certain things made you feel. And that's it. So it's not just very sort of by the book and very this happened, so this happened. It can be a bit more personal to you. It's usually you don't want to sort of be telling the whole story about every little thing you've done. You just want to get into the nitty gritty of what it is you learned from and what were the significant things in that event that you're reflecting on. And then as well, finally, it's useful to reflect forward into the future as well as looking back. So you might have done something, you might say, been a doctor on the ward and done something wrong and thought, I did that wrong, I can do that, I should have done it this way. But in future, you could say, in future, to prevent this happening, I'm going to do this to help me stay on track with this, etc. So as well as looking how you would have fixed the event in the past, look forward to see how you'll make things better when you do that same thing in the future. Pop on the next one there, please. So why is it important for you guys as aspiring medical students? It allows you to expand on your work experience. Kind of what I was saying earlier there, you don't just want to say, I went to the hospital and I watched the surgery and I saw the patients. Like, you want to say, be able to expand on it and say what you really learned from it, the skills that you saw were needed for being the surgeons, the appreciation you took for the patients and the difficult journey it was for them, if it was like an emergency surgery or something like that. Again, it's really important for you guys, because whenever you're applying, it gives you a leg up, because it'll show that you've developed an understanding and even be able to use a skill that will go on throughout the rest of your medical career. So being able to reflect in your personal statement and in your interviews is all really important. And it lets the people that are either interviewing you or seeing your personal statement know that you got something out of the work experience, and that you didn't just go there and sit in the corner and be quiet and just do the time. And if you do it really well to impress, then you'll be able to really boost your application with it, and they'll really see that you've got a good handle on not only understanding what it is, why you want to do medicine, but how you're going to get stuff out of it and how you're going to progress further and be good at like the lifelong learning that comes with being a doctor. Pop on the next one there, please. So this is a wee example on reflective writing. I thought I'd take a very unmedical one to start off first. So because there's lots of medical jargon and things at times. This one, I'll read it out here and I'll go through some of the important things of underlying some of them, but this is just a basic one. It could be like a school project you're doing with a group or something. So I'll go through it here. Although the atmosphere within the group was cooperative, no one seemed willing to make decisions about how to divide up tasks. Eventually, I stepped forward and drew up a list of tasks and people, but I was aware that this might be seen as an unfair way to proceed. So already you see at the start there, they've got a wee quick setting of the situation. They're doing some group work. People aren't really cooperative. And then there's a few I statements that I've underlined here. So the person who's done this has said they stepped forward and they drew up this list of tasks, but they were aware that it might be an unfair way. So you've seen what they've done, and they've also taken some feeling into it to see that they've weighed up the group dynamic and seen how it could impact things. So going on then, I realized I was pushing people to act, but I felt it was important that we started to work on the project as soon as possible. So again, more identification of what they were doing and how it was impacting things, not just I told people to make a list and I told people to do this. Like, they really dug into it and what it was actually, how it was affecting things and how they were, you can see the cogs working on how they were moving forward with this and how things were going to be changed possibly. So then going on the last wee paragraph there, although we had a successful outcome, we should maybe have found a way to include everyone in the process of decision making at the start. In future group work, I will probably suggest this and be aware of how that will help the group dynamic from the start. So you've got the kind of looking back on what happened here and also looking forward to how things could be differently. So they've said, looking back, maybe could have got people a bit more involved. And then they've also not only sort of corrected that in retrospect, they've said for in future, whenever they're starting out on group works like this, they'll try and develop a way that they can get everyone stuck in together. So hopefully that sort of makes a bit of sense on what we're talking about with the identifying the situation. Really small, just the first sort of sentence just is the situation that's happening there, or the event, and then a lot of it is the personal thoughts and feelings of what the person did themselves in the event, and then looking how they could have changed things for in retrospect and moving forward in future. Can we go to the next slide, please? So a really simple 3-step method that'd be good for you guys at the minute. There's lots of different methods, and there's no right way to reflect, but there almost is a wrong way. Like I'm saying, you can leave stuff out, and you can write too much about the wrong things. So what happened and when, basic details, like I was saying there, it doesn't need to be a huge amount. It also doesn't need, especially as well when you're reflecting, it doesn't need to have personal identification. So if you're talking about patients, things like that, you keep that completely anonymous, and even sort of dates and locations, keep them all anonymous as well. That's more for sort of patient confidentiality, but it'll get you in the right frame of mind that whenever you're reflecting, you're getting across the information, and the people reading it don't need to know that patient. They don't need to know where you were during the work experience. They just need to know the situation that happened. then so what? So like it says there, how you felt and understand what happened at the time. So like that person was saying, I told people what to do, and I felt it was a bit unfair. So you can include your feelings, but also like anything that surprised you or anything else that seemed important or anything else that you sort of got from that event, or the impacts that you made on that event. So anything at all, it can be good, it can be bad, it can be something that really you didn't expect to happen, including it so that you're trying to illustrate that you're aware of what happened and what sort of impact it had on things. And then what next? So like I was saying, looking back at the event on how you could have fixed things in that specific moment in time, but also looking forward to the future. So if you're on work experience and you ask your supervisor about something that happened, like you were watching a hip operation, you could go back and read up a wee bit more on it and solidify your learning. So with that, you'll see a bit later, because I've included an example of how I have done some reflection in my training. But looking towards the future, especially with your work experience, you're not going to have a huge lot of things where you'll be able to say, oh, next time I'm on work experience, because all being well, you're not going to be doing more work experience. You're going to be in medical school and you're going to be doing things. So you can say, I saw a hip replacement surgery and I went and read up a bit more about it so that I was able to appreciate the aftercare and things that needed to happen that I didn't see on the day. So that's a bit of a specific example, but things like that, things that you can move forward with. So let's see the next one there, Mark. So we've kind of talked a bit about before, and then in medical school, it changes and it continuously evolves. But after medical school, like I was saying, it's very important. In your foundation years, your FY1 and FY2, after you graduate, you have what they call continuous reflective entries on clinical cases, also on learning events and teaching. So one thing you'd even practice on is doing a bit of a reflective entry on this session tonight. In the foundation years, it's not a huge amount. It's about 20 or 30 over each year, which seems like a lot, but if you're spreading out, that's only one every couple of weeks. If you do a training portfolio, so like medical, GP, surgical training, you will again have continuous reflective entries with the requirements differing depending on the specialty. If you're doing surgery, you might keep a logbook of the surgeries you've been part of, and it'll be really important to reflect on all the core ones that you're competent with, appendectomies, competent with gallbladder removal, things like that, all the basic ones. And with that, you're trying to really achieve a good spread over everything so that when you come to the end of your training, you can say, I can do all of this and I will be a good consultant and I've not got any gaps. GP training, same sort of thing, but it's probably the most heaviest with the reflective viewpoint, and you do about 2 reflective entries per week roughly. It has just changed very recently, and it'll probably have changed again by the time you guys get to it if you're doing that, but it's quite reflective heavy, and with that you're really trying to cover again the whole basis of everything. And I guess GP has no gaps, so anything that you do can be interesting and relatable to GP. So again, you can reflect on it. Next, please. So this is a reflective entry that I've literally just copied and pasted out of my portfolio from whenever I was in GP training. And I thought I would just go through it because it shows you not what you need to be right now, but what like things can be whenever you're a few more years down the line, and hopefully it'll give you some tips on how to do some real life experience. So this is the way. It's a platform called 14 Fish that we use for the GP portfolio, but it's laid out there. The setting is a telephone triage, brief description. As you can see, it's maybe a wee bit longer than a few sentences, but it's the bulk of things is actually in the secondary part down below. So I'll just read through it. So phone call from a single young mother with an infant who was discussing mental health, found during the phone call to be between permanent housing due to losing her rented flat and needing to stay with different family and friends. No concerns of safeguarding. However, I feel cues were recognised to offer help with regards to social situation, offered social work input and letter for housing executive. So brief description of what the patient was, who they were, what they were there for, and what happened. not massive amounts of detail, just a quick run through of it all. Then the way the GP training does it, you can reflect, there's 12 capabilities and you reflect on specifically on each of these, and you want to have a good covering of them all by the end. So you can choose 3 per reflective case. So here for the data gathering and interpretation, I've said, I feel with this case, I was able to respond to cues very well and build rapport to allow the patient to divulge sensitive information. And again, that's a very succinct thing with what I was feeling there, and also what it was that happened and how I felt that I was able to do that well. Community orientation, I was able to offer resources such as social work and letters for the housing executive, which the patient was not sure were available. I feel with this, I was able to show how I can explore my use of resources outside of the medical management to help the patient. So again, this is illustrating that you can do things well. So with this, I was sort of trying to illustrate that I was able to not only go through the mental health side of things, but offer the additional social support and things like that were available. So you might not have got much of that out of the wee blurb at the top, but whenever you illustrate it like that and how you say you felt that you were able to do something well can really highlight it better. And you can do a similar sort of thing with your work experience learning to make sure that the assessors or whoever's in your portfolio know like that you understood certain aspects of it. Then finally, they're maintaining an ethical approach. There was a weighing up of the need for completion of a Unicini. A lot of you probably don't know what that is. That means understanding needs of children in Northern Ireland, and it's a social work form. They're called GIRFEX in Scotland. I'm not sure what they're called in England, but that's just what that is if there's children and safeguarding involved. But however, careful exploration of the situation and gaining confidence with the patient's insights and plans with her social circumstances and her own mental health, I felt not only that a Unicini was not required, but could be detrimental to the situation of the patient and her child. So again, that's a bit of reflecting on the situation, on what I did and what my thought process was with it, and how exactly I had made those decisions. There's a few wee supervisor comments at the side, just popped in, don't need to worry about those. But then finally, the wee bottom bit, which is probably one of the most important bits, especially for you guys moving forward here with this. So they have these for every single one of the cases that you do in training. So reflection, what will I maintain, improve, or stop? So I had said, I feel this case was managed well and I was able to demonstrate good medical practice. And I guess I kind of lumped these in 2 together, but then I've said ongoing updates of social resources and specifically resources in the geographical area I am working. So I was with that saying that, yes, I knew about the housing executive letters and the Unicini, et cetera, but to continue my own development, if I'm working in a different area, I want to make sure that I know exactly what I'm doing and what options are available to me. So similarly, that can be like for you guys with work experience, you could see something in a hospital environment and then the patient's discharged back to their GP, and you could say, if able, I'd be like to maybe follow up and see what sort of happens whenever the patient goes back to GP, things like that. So a bit more than just what happened in the situation, looking forward to the future as well. Next one, please, Mark. Oh, so there we go. Questions. Hopefully I didn't fly through that too quickly for you, but I think we've got a lot of questions there, Mark.
Yeah, I think the timing was pretty much spot on. 26 minutes past, so it was a bang on 20 minutes, which is great. I just had a few questions just while I bring up the Q&A here. I might have to stop my screen share for the Q&A. But kind of when you were applying to medical school, did you feel like you knew how to reflect properly, or how long did it take before you felt competent reflecting on experiences?
I would say for medical school, applying to medical school, I knew nothing about reflection, and I don't think it was on my radar at all. It was maybe a bit more of a newer thing coming in, and I don't think they were really expecting much of school applicants to have much of that. But certainly, as soon day one, whenever you get into medical school, it's kind of something that's on the table for you to continue your learning. And it probably took me a good while to get a hang of it. Even as you keep moving through things, the sort of the level goes up and the expectations go up. So you keep developing it yourself, but I think it'd be good to get on the ball now and really try to get grips with it. Just like even that simple structure there, the one that we showed you on the presentation, you might get more in-depth structures as you go through medical school, but definitely building it up slowly is a good idea, and it's something that you kind of have to do anyway, so it's good to get on it now.
Yeah, I think something we've seen is the like you said, the expectation to reflect has grown in popularity. I think medical schools these days are really looking for competent reflectors, even at the application process. And something we see is that it definitely differentiates students from the students that list things versus the students that reflect on a few key scenarios. Is that something that you've kind of seen change as well in the application side?
Definitely, yeah. And again, you don't need to be an expert at reflection, but you need to be able to show that you took something away from your work experience, and even better than that, you took something away from it and you developed it further in your thinking, and your sort of, you didn't just do the work experience and it was done and you're sort of tick it off the list, and that you use that to springboard onto something else. So definitely, yeah.
Cool. I'm just going to see if I can open up the Q&A. I might have to stop my screen share, so it might make, just give me 1 second, see if we can do that. Q&A. Cool. Right, okay. I think we're there. So first question here is that this has kind of got quite a few votes in it. So what extracurricular activities would you say are really good for medicine? And that can be reflected on quite well, just to tie it in with what we're doing here.
Yeah, so I saw that one there. Yeah, it's not that there's any are better than the others. I would say the most important thing with your extracurricular activities is that you're able to show some transferable skills with it. Be that sports, things like that. Working in a team is a big part of that, and medicine's working in a team. So, I mean, most sports and things like that have team aspects of it. So that's definitely something you can draw across. Other things, like musical side of things, sort of performing under pressure, things like that is transferable skills. It's not something that you need to massively worry about, that it's an interesting hobby, as long as it's a hobby that you can show that you've taken time and interest in, you've shown some dedication to. That's quite good, but also that you appreciate that you have done learning in that, and that can be used in other ways sometimes. So
cool. I'm just going to work my way down this. So what is the best way to phrase the introduction of your personal statement? It's not directly reflection based, but a lot of the personal statement should be about reflection anyway.
Yeah, I think a big thing with your personal statement is the word limit. And similarly to the reflective side of things, you don't want to get bogged down in stuff that doesn't really matter. And it might sound harsh, but I mean, the medical schools are going through thousands of these applications, and you really need stuff that's going to stand out. I mean, 90% of them are going to be sixth year school students who've done A levels and things like that. So I mean, that stuff's in your application. So I would say just skip the stuff that's all the same, and really get to the good things that really identify you as a good candidate and really set you apart. So I would say keep it succinct and keep it to the things that are really specifically relevant to you, and they're not going to be seen on every single application. Again, you probably have a bit of help in your school with sort of tutors and things like that who be able to help you tailor it a bit better for you. But yeah, I think just making sure that you're not including too much guff that they're not really isn't going to grab the person reading its attention.
Yeah, I think one of the things that we always recommend when we're talking about personal statements as well is almost leave that opening sentence to the end, because it can be such a blocker to starting your personal statement, is thinking about, oh, how I'm going to make this amazing first sentence. Just leave that till the end. And if you've got like a work experience diary or a reflection diary, start with that bit and start putting the building blocks of your reflection into a personal statement or into some kind of structure before you write that first line. It's a lot easier to write a first line at the end than it is at the very start. Nobody likes starting with a great opening sentence because it's really difficult to do. So just don't let that block you. Next one down from Lucy is, will year 12 students be penalised for not having as much work experience due to COVID, obviously? So I guess they're going to have less opportunities to have reflective moments. So do you think that they'll be kind of penalised, or medical schools will be very aware of that?
I think medical schools are going to be aware of it, but I think the important thing is to not use that as an excuse to do nothing. So coming to things like this, make sure that you include this and what you've been able to do outside of the sort of typical going to hospital or going to GP surgery to sit in on things. So I would say definitely trying to find other things to fill that gap, but you're not going to be penalized, and then everyone's going to be in the same boat as well. They're going to understand if somebody's taken a year out and got all this extra stuff before you, then that you weren't able to do that. You weren't able to anticipate COVID and all this stuff. So I wouldn't worry too much. Just don't use it as an excuse to completely sort of have that section blank.
Yeah, and the quality of your reflection, if you're, like you said, attending things like this, if you reflect on this really well, then that's the thing that's going to help you stand out, not the fact that you haven't been able to get hospital-based or GP experience. So, but everybody here is already making a good start. So you've got a good head start on most people. And this kind of leads into that again, like from the medical applicants, and if you've done any reading personal statements, has there been anything in those that have stood out to you?
Again, there's a lot of it is the same, so it's probably very personal to certain things that you can write about yourself. I mean, everyone's in the same boat. They all need the grades. They all do the same subjects. Everyone has extracurricular activities. It's what you do with that and how you personally make that applicable to your application. So, I mean, there's probably like thousands of people applying that have the same extracurricular activities as you, but the way that you can say how that will make you a good applicant for medicine, or it could make you a better doctor, is one thing that will make you stand out, rather than just saying it's something that you've done. And other ways to stand out would definitely be how well that you write it, especially like the quality of your reflection and things like that. So if you're able to put together a really good piece of work for your personal statement, that's going to make you stand out, because most of the other stuff, like say the grades, the application deadlines, things like that, the work, even almost the work experience, is just going to be ticking it off to make sure that you have it. But if you can really sell it and sell yourself on the personal statement, with your personal growth and the personal identification of what you can take away from these activities, I think that's a big thing.
Yeah, I think I'd say the same, especially in personal statements, is that the quality of how you communicate your experiences, which comes from reflection and doing that really well. And then the same at interview is being able to communicate the experiences you've had really well. And I think students that have a very clear idea in their mind and a clear framework of, I did this, I learned this from this, and I'm going to take this forward, exactly the same structure you were talking through before. If you have that structure and you can communicate in that structure really well, that's always a thing that stands out when we're doing kind of mock interviews and things. So, it might just seem to some students, oh, this is just for your personal statement. It's not. It's for your entire application process, and it's going to be the thing that makes you stand out across everything, really. Next one down is a bit of a difficult question. How do I get work experience in the NHS/healthcare related settings? It's very difficult at the moment.
Yeah.
There's most hospitals around us aren't currently taking students. There's some online volunteering that you can do, but seeking other volunteering opportunities is probably your best bet for some things right now. I know there's a lot of charities that do kind of volunteering with the elderly via Zoom classes and things like that, or reading to young children. I'll see if I can find some links to those things and post them in the chat. But I don't know if you know of any others that you want to mention.
It's very difficult, and I think it's going to depend on your area and how things are and local to you. But even if you can't get direct sort of healthcare, get in there and get in with the nitty gritty, even if you're able to maybe get a bit of like a session or something like that with somebody who works in healthcare and ask a few questions, and sort of even just have a meeting to talk about things, that could be useful as well. But yeah, it's very difficult at the minute. Again, everyone's going to be in the same boat, so I wouldn't worry about having on the ward experience sort of right in the front lines, but doing things like this or anything else that you can really make applicable, it will be useful.
Yeah, and I just want to mention, obviously we have the GP course and the ward round live course as well, where we live stream patients. I know that they're kind of paid for courses, but as an option, if you're really struggling and you can't find anything, maybe, you know, check those out. At least it gives you the opportunity to speak to patients, see medical cases, and we actually do help with the reflection part as well. So check those out if you're really struggling. How do we fit all of our work experience, extra reading, qualities, how we want to go into medicine, all into 4,000 characters? It's quite a lot to fit in.
Yeah. Again, take out the stuff that doesn't set you apart. So let's see what you said, work experience, extra reading. So I mean, you don't need to go into detail about your work experience and where you did it and what ward you were on, and even sort of things like that. If you could just say, like, I did surgical work experience, and then bam, straight into a reflection about something that you identified there. Extra reading, again, you don't just want to list off a list of new scientists or things like that. You want to say something you've been reading and what you've taken away from it. So pick something that's really good and that stands out, and something that you've been genuinely interested in as well, because that will come across better. I mean, you could read every edition of New Scientist or journal papers and BMJ and stuff like that, and you could read every single issue, but it doesn't really matter if you just list them. But if you find something in one of the issues that you're really excited about and really took your interest, then talk about that and talk about how, like, moving forward, if you want to work in that line, something like that. So and then what else? Qualities and how we got onto medicine. Yeah, again, just like you don't need to have a big story about how you always wanted to do it since you were 5 and you've been doing stuff all through the years. Like, really key points, being succinct. It's an exercise in itself, and it is something that is really difficult to keep it all down, the word count, but it's again, it's something that's going to be the test for moving forward. So being able to do that better than somebody else will really help you. So
cool. I don't know how to write about my volunteering in a ward. Well, fantastic that you've got something on a ward, because I haven't done anything special. Would writing about my interactions with patients be good?
I think
there's a lot of good things in there.
Yeah, I think you're selling yourself a bit short there, because it is special that you've got on the ward and you've had interactions with patients. That's really good too. There's a lot of work experience students who will come and they won't talk to patients or anything like that. So you've got great things there. You could certainly talk about anything, but again, make it something that you're interested in and something that you're really able to take forward or apply to something. So even if you're just in the ward and you went on the ward round, you'd be able to say, like, I appreciate a ward round is very typical of most medical specialties and happens every day. Something you need to be really organized for, et cetera, et cetera, et cetera. You could talk about the interaction between the doctors and the patients. You can talk about interaction between the consultants and the junior doctors, things like that. Something that you've recognized from it and being able to show that you've taken something away from it and that you've learned. Think anything as well that you maybe went in and you were on the ward that day and you're like, oh, I didn't realize that happened. That's perfect. You can talk about that and say how you were able to understand that this is what happens here. And I think, yeah, the fact you've been on a ward is really good. And hopefully it wasn't ages ago and you've forgotten it all, but think back and maybe even, I would say, I think I saw another question later about sort of how to make the most of it, but I would say maybe at the end of every day of work experience, just make a wee quick note of interesting things or things you didn't know or things that you did see. Like just a wee quick note, like patient in surgery or patient getting medication, et cetera, like, and then by the end of your experience, you'll have a good wee list of things and you can pick out the best ones and sort of put them in the personal statement.
Yeah, I think a work experience diary is absolutely vital, and fantastic that you've managed to get some ward-based experience, but keeping a diary of that so you don't forget it later on is just essential. So if anybody's planning their summer work experience, or maybe you've got some now, just keep a note of it somewhere. Even if it's just in your phone, just make sure you've got a note, because you'll forget 80% of it. Cool. I'm just conscious of the time. Maybe we'll try and find one, maybe two more questions, and then we'll kind of wrap it up. I don't want to take too much of everybody's evening. Try and find some questions slightly further down to give everybody else a chance. Some things about the UCAT, probably not the webinar for that. If you don't manage to get clinical work experience, how would you recommend the reflection can be linked to a clinical setting? Quite tricky.
Sorry, I think I lost the question. If you say if you don't get, what was that question again? Sorry.
If you don't manage to get clinical work experience, oh, it keeps jumping around, I keep losing it. If you don't manage to get clinical work experience, God, why does it keep moving? I think as people are typing new questions, it like bumps it up and moves it.
Yeah.
I'll find another one. I'll find another one near the top that doesn't keep moving.
Sorry.
Will it be fine if I only do one form of volunteering / work experience? Is the second question at the top.
Yeah. I mean, it's not a numbers game. You don't need loads of hours. It's about getting in and knowing medicine's for you, and being able to relate your work experience to your application. So, I mean, it really depends what you've been doing. If it's really loosely related to medicine and you only did maybe a day or two, it might be better to get a bit more. But if you got one day on the ward, that's great. You don't need a whole week. You can just really take a lot out of that one day and really apply it. You'll get to see bang on what happens with doctors, how they work and things like that. So yeah, it's not about the time, it's about how you bring that across yourself and what you take out of it. So no, definitely should be okay.
I think that's a really nice way to kind of summarize and kind of wrap up the webinar, actually, because it's the quality of the work experience you get, all the experience you get, and again the quality of how you reflect on that, and hopefully that kind of structure that you talked through before will definitely help students with that. So yeah, thank you very much for your time this evening. It's been a pleasure talking to you, and thanks for kind of going through some of that and actually showing your personal reflection as well in there. I think that's really good for students to see that it's not just something they need for the personal statement, it's going to be there throughout their entire medical career. So yeah, thank you very much for joining us this evening.
No worries, thanks for having me.
Okay, guys, we're just going to end the webinar there. We'll send a copy of the slides and a recording of this as well, and we'll upload it to the YouTube channel. So thanks very much for joining us. We'll have another webinar in a couple of weeks. So start the reflection, start a reflection journal at least, and we'll see you in a few weeks. So thanks for joining us. All right, cheers.
Thanks. Bye-bye.